All right, guys, welcome back to Underground Science. In this video, we'll be talking about subclavian steal syndrome. Okay, so let's go and get started. So in this syndrome, right, we have to know what the major vessels are that are involved, right? What are the major vessels involved? Okay, so the major vessels that we should know that we'll talk about are the aortic arc, right? The aortic arch. It's going to be the subclavian artery, the vertebral artery, and the basilar artery. Okay, so those are the vessels that are going to be involved in this subclavian steal syndrome. All right, so first, before we talk about it, right, we should know where these vessels are, okay, and where they branch off of. So if we just focus on the aorta, right, if we draw it big like that, and so we know that's the aorta, and we know the three main branches off the aorta, right, is the brachiocephalic trunk, the left common carotid, and the left subclavian, right? So off the brachiocephalic trunk, you get your right subclavian, right? So you get your right subclavian. So let's just draw it like this, right? So you get your right subclavian artery, and you get your right common carotid artery, your right common carotid artery. All right. So let's go and write that a little neater. So this is going to be your brachiocephalic trunk, right? So brachiocephalic trunk, okay? And off your brachiocephalic trunk, we're going to have your right subclavian artery and your right common carotid artery, right? So let's just draw a branch like that, indicating that another branch off of the brachiocephalic trunk is going to be your right common carotid artery. Okay, and then we said that this was your left common carotid artery, and then this one is going to be your left, let's write that better, left subclavian artery, right? Okay, so that those are the vessels, those are the main vessels to know. Okay, so now that we're familiar with where these vessels originate from and where they are, right, let's talk about what subclavian steal syndrome is. Okay, so let's go and draw that again. Let's draw our aorta, right? And we're going to draw our three branches. So what happens is, right, let's take our left subclavian artery as an example, okay? So that's our left subclavian artery. And as we know that your left subclavian artery, when it goes down to your axillary region, it becomes the axillary artery, right? And then your axillary artery becomes your brachial artery, okay? And then your brachial artery branches into your radial artery and your ulnar artery, right? So that's the general track when we're starting with your left subclavian artery, right? But what we also know is what's another artery that branches off your subclavian artery, right? It's your vertebral artery. Okay, so your vertebral artery is a branch off the subclavian artery. So if we were to draw something like this, where we said, okay, a branch, we're gonna draw right over here, and we're gonna say that this is your vertebral artery. Okay, right here is where the subclavian steal syndrome is relevant. Okay, so what happens is we're going to talk about the causes, but for now, let's just focus on what happens is you get some sort of narrowing or stenosis, right, of the subclavian artery proximal to the vertebral artery. All right, so it's narrowing proximal to the vertebral artery. All right, so again, you get stenosis of the subclavian artery, right? So see how it's getting very narrowed now, right? So you get stenosis of the subclavian artery proximal to the origin of the vertebral artery. Okay, so proximal basically meaning that it's before the vertebral artery, right? We can see it's before, not after, but before. Okay, and so this is relevant because this is how you get subclavian steal syndrome, okay? Because the narrowing occurs before the vertebral artery. Okay, so like we still don't know how the subclavian steal syndrome occurs, right? So we said that your left subclavian artery eventually, right, as we can see here, gives turns into the axillary artery and then the brachial artery, and then the brachial artery branches into your radial and ulnar artery, right? So we can see here that your left subclavian artery eventually will give blood supply to your left arm, okay? Because it's going to branch into your left axillary artery, your left brachial artery, and then your left radial and left ulnar artery, right? But if you have narrowing here, then isn't that that's gonna affect the blood flow, right? Going to your arm, okay? Because what's gonna happen is when the heart contracts and the blood from the aorta is supposed to enter your left subclavian artery, this is very narrowed, okay? So not much blood will be able to enter your left axillary artery, and then therefore your left brachial artery, and then therefore your ulnar and radial arteries, okay? So you may see a low blood pressure in your left arm compared to your right arm, okay? But what this narrowing is going to do is because you're not getting much blood to your left arm, right? Because of this narrowing in your left subclavian artery, that means that you're going to have a low pressure, okay? You're going to have a low pressure due to the stenosis, all right? So you're going to have a pressure gradient, all right? So you're going to have high pressure in your vertebral artery, but low pressure in your left axillary artery and downwards. Okay, and if you have low pressure here and high pressure here, things like to go from high to low pressure. So it's going to create a pressure gradient where blood will flow backwards now from your vertebral artery to your left axillary artery, right? Specifically to your subclavian artery, right? Then to your axillary artery. Okay, but that's the main point is that the brain circulation pressure is higher than the arm circulation pressure. Why? Because of this stenosis in the subclavian artery, right? If the subclavian artery is narrowed, not much blood is going to go to your arm now, right? In this case, the left arm. So that means your arm circulation pressure is going to be low, okay? And your brain circulation pressure will now be higher, right? Compared to your arm circulation pressure, okay? And that's going to create a pressure difference. So blood will now flow from your vertebral artery to your subclavian artery, right? After the narrowing of the subclavian artery, right? And then eventually to your axillary artery and downwards to your arm. So what that's doing is you're shunting blood away, right, from your vertebral artery, which means you're basically taking blood away from your brain, right? So that can cause neurological symptoms. Okay. So what are certain findings that we see? Well, let's take in exercise into account, right? If you're working out your left arm in this case, that means your muscles of your arm will need more oxygen, right? So the arterioles that supply your muscles will dilate, right? They're going to vasodilate. And if then that's going to reduce the resistance, right? And so if you're working out, right, let's say your left arm, and there's blood vessels like small arterioles that supply your muscles, okay? So let's say this is your muscle, they're going to vasodilate because they want more blood flow so your muscles can have more oxygen, produce more ATP. But vasodilation reduces systemic vascular resistance, right? So if resistance drops, right, then more blood will flow to wherever there's lower pressure, right? So more blood then will flow to your arm muscles. But here we just said that where will that extra blood be coming from? the vertebral artery circulation, right? Because this is already narrowed, right? So you're not much blood will be able to make it past this narrowing. So the only option is take more blood from the vertebral artery circulation and bring it to the blood vessels of the arm, right? So eventually to your axillary artery and then to your brachial artery. Okay. So something you'll notice is arm ischemia. Okay. So one finding is going to be arm ischemia. Okay. And why is that? Because of that narrowing that we saw in the subclavian artery, right? So certain things you can see is arm claudication, right? So you're going to have that tightness, that pain while trying to work out that arm. And you're going to see fatigue, of course, because of the reduced blood flow due to the narrowing of the subclavian artery. You're going to see a weak pulse because there's less blood now going to your left arm due to that narrowing. And then you can see cool extremities, right? Because of again, the less blood flow going to your left arm in this case, because of the narrowing of the left subclavian artery proximal to the vertebral artery. Okay, and because we said that you create your arm circulation pressure is low, right? That's why you see a weak pulse too. If your arm circulation pressure is low, why? Because of the narrowing in the subclavian artery, right, proximal to the vertebral artery, and your brain circulation pressure, right, is high, then that means that blood will flow from your vertebral artery circulation to your left left axillary artery and onwards, right? To the blood vessel supplying your arm. So eventually you're going to get more blood flow coming to your arm, but that blood is coming from the vertebral arteries. Okay? So that's going to mean you're going to have neurological symptoms because the vertebral artery supplies your brain, right? So you can see things like neurological symptoms. Okay, neurological symptoms. All right. And so some of that would be dizziness, right? Vertigo, syncope, right? Because you're taking blood away from the brain, so you may have a syncopal episode, and you may even see balance issues, right? So you may see ataxia. And of course you can see things like blurred vision, right? Especially because again you're taking oxygen away from the brain because you're taking blood flow away from the brain, right? That's why it's called subclavian steal syndrome, because due to the narrowing of the subclavian artery, not much blood is going to your arms, right? So the only access that your arms have, but the only access the blood vessels of your arms have is the vertebral artery, right? So it tries to take blood away from the vertebral artery so that it can properly supply your arm muscles. But in doing that, if you're taking blood away from the vertebral artery, then you're taking blood away from the brain. See, that's why you see um, neurological symptoms like dizziness, vertigo, loss of balance, syncope, blurred vision, right? And things like that, even drop attacks, right? So if someone's working out their left arm really aggressively, that's going to pull a lot of blood away from the vertebral artery, and that can lead to sudden drop attacks, right? Because of that sudden decrease in perfusion going to the posterior brain, okay? Or going to the posterior circulation of the brain, right? So we said that we said that if you see your aorta again like this, and then you have your subclavian artery, then you have that narrowing, right? That stenosis proximal to the vertebral artery, right? This is the vertebral artery, this is the subclavian artery, right? Specifically the left subclavian artery. And so we said that if there's a narrowing here, what does that mean? There's less blood going to your left arm, right? Decreased blood going to your left arm, right? There's going to be decreased blood going to your left axillary artery, left brachial artery, and onwards. Okay, if there's less blood going to your left arm, that means your left arm blood pressure will be lower than your right arm, right? Due to the narrowing. So another thing you can find is a greater than 15 to 20 millimeters of mercury systolic BP difference, okay? Blood pressure difference between the two arms. okay? So whatever the affected arm is, it's going to be lower. You can even take the opposite example. If the right subclavian artery is narrowed proximal to the right vertebral artery, then that means the right arm would probably have a lower blood pressure than the left arm because there's less blood flow going to the right arm, right? So it would take blood away, it would steal blood away from the right vertebral artery, okay? So same concept goes on the other side too. And then now the only thing left is to talk about, okay, well, we know that stenosis happens proximal to the vertebral artery, right? Stenosis of the subclavian artery proximal to the vertebral artery. We totally understand that now. We understand why the blood pressure difference is there. We understand the steal mechanism, right? Because of the narrowing of the subclavian artery, less blood goes to your arm. In that case, the arm will try to take blood away from the vertebral artery, therefore decreasing perfusion to therefore decreasing circulation to the brain, right? So we understand all that, but what causes that stenosis and narrowing, right? We have to talk about that. So let's talk about the main causes that we should keep in mind, right? So the number one cause would be atherosclerosis, okay? So over time, right? Over time, right, chronic elevation of LDL, right, bad cholesterol, you can get cholesterol deposits, calcification, right, in your blood vessels. And so if we again took the aorta, right, and drew the subclavian artery and then the vertebral artery, right, over time you can get that calcification and that cholesterol plaque buildup, right, and that can cause narrowing, leading to decreased blood flow going to the left arm in this case, right? So again, that's going to create a pressure difference. There's going to be higher pressure in your vertebral artery, lower pressure in your subclavian artery after the stenosis, right? So lower pressure here. So that's going to cause blood to rush to the blood vessels of your left arm, which means less blood will go to your brain. So that's why you can see neurological symptoms, right? So that makes sense. Another cause that we should keep in mind is Takayasu arteritis, right? And we'll talk about that in our vascular system playlist. Okay, but Takayasu arteritis is basically inflammation of your arteries, which causes it's granulomatous inflammation of your arteries, okay? So which will cause um, fibrosis and intimal thickening, right? So you're going to get fibrosis and thickening of your major arteries, in this case, your subclavian artery, proximal to your vertebral artery, right? So if your vertebral artery is right over here, and you get thickening and inflammation and fibrosis and narrowing here, right, in your left subclavian artery, in this example again, right, then less blood flow will make it to your left arm, right? So then again, you decrease pressure in your left arm. Therefore, you have a pressure difference between your vertebral artery and your left arm. So that means blood will rush to your left arm, leading to less blood flow, right, to the brain. So you're going to see neurological symptoms. And because of the less blood flow going to your left arm to begin with, you can see that blood pressure difference and the arm claudication findings that we talked about. Okay, and the last cause we should keep in mind is some type of heart surgery or vascular surgery, right? So heart surgery or some type of vascular surgery um, that could potentially also lead to injury or narrowing or fibrosis or inflammation of your subclavian artery proximal to the vertebral artery, again leading to those symptoms like the neurological symptoms we talked about and the arm claudication findings that we talked about. All right, so I hope this video wasn't too confusing. I hope this video made sense. I hope you guys understand what subclavian steal syndrome is now. Thank you guys for watching and see you guys in my future videos.